I think the first one is probably a little bit unusual, but it's to think about the burden of that treatment or those treatments for that individual. It goes beyond looking at the burden of having a disease, but it's the burden of having to deal with very complicated medication regimens, having to take lots of medicines, having to juggle that around your busy day. But also alongside that are all the issues related to having to go to lots of clinics, having to have lots of blood tests for monitoring, maybe having to go up to the hospital, and just to understand really the implications that has for patients. And that should just looking at that from that perspective and asking patients, being very patient focused, asking patients how they're managing, how they can cope with taking all those medicines, gives people a good insight into how best to tailor regimes, but also maybe to stop some of those medicines if necessary or if possible. That's the second point, which is to also concentrate on deprescribing. So a key message, I think, is around stopping medicine and deprescribing. It's not easy to do. It can be quite difficult for a clinical pharmacist or a pharmacist. It's easy with some things like laxatives maybe or painkillers, but some of the more complex things like drugs that are being used for cardiovascular disease prevention, I think if you feel very strongly that the patient isn't going to get much benefit from that treatment, there needs to be a discussion with the doctor. And that leads very neatly onto my third point, which is I think you need to think clearly about how you work in teams, how you interact with your doctors in the practice, how you work with nurses, and how the pharmacy team integrate within that system, because a lot of these decisions are difficult. And I think it's really important that as much as possible they should be collective decisions, obviously with the patient, but it shouldn't be that one person takes it upon themselves to do this. It is difficult and requires a lot of discussion and sometimes negotiation as well.